Hi, I'm Dale Sherbeck, and welcome to the HQ, a CHA Learning and Healthcare Can podcast serial where we dive into the healthcare issues and topics from the perspective of its people and discuss them with those that are leading in the health system. Together, we'll try to unpack these topics and learn what actions are being taken to innovatively solve them today. Over the past 2 years, we have been inundated with media about health and healthcare. During much of this time, it has focused on COVID-19, pandemic numbers reported daily, and ever-changing policies as our world and communities have grappled with containing the virus. But there was always another narrative running through this, about the impact all of this was having on our healthcare system, and indeed many of the policies that have been developed over the past 2 years have been presented in terms of how we can protect our health system and facilities from becoming overwhelmed. Increasingly, this narrative has been morphing and moving away from the inanimate parts of the health system, away from discussions of PPE, beds, ventilators, and ICU capacity, to the impact all of this is having on the people who work in healthcare, and the two-front crisis our system is facing: the health and wellness of these workers, and the shortage of people who make and deliver our health system. The two issues are integrally linked, and by all accounts, they are not singular in their cause or solutions. Here on the HQ, I want to use this platform to look at things from different perspectives as we try to understand other facets that might not have been discussed. Consider, what is it like to be a healthcare leader during the pandemic? And when we talk about shortages of people, why are we talking about immigration and how it can help us out of this crisis within our own country? This is part 2 of our episode on the psychological wellness of leadership during the pandemic, where I've been speaking with Kristen Winter, Vice President of Human Resources, Workforce Optimization, and Leadership at Sunnybrook Health Sciences Centre in Toronto. In part 1, Kristen has shared very candidly about what it's like to be a healthcare leader, and especially a people leader during the pandemic, and the impact it has had on her team and the way she leads. Let's pick up the conversation with her again, where she answers the question about how she sees herself coming through this and back to normal. How do you see yourself coming through this, even personally, Kristen, taking care of yourself? Because I know, from stories and conversations that we've had, that yes, you're working there, evenings, you're on, on weekends, you're working on holidays, which doesn't make you a martyr, but it certainly makes you a human that's, worked a lot. So how are you going to come back to normal?
Yeah, I mean, it's a great question. I'm still trying to figure that out myself. I'm not certain. I certainly think that for me personally, vacations are super important, and I know that about myself. I know myself well enough to know that I know when I need a couple of days off. I know when I need to catch my break, and I'm surrounded by amazing people that I can lean on to take the lead if I need to take a couple of days off. And I think, I'll give you a really very specific example. I'm going to take Thursday and Friday of this week off, and I'm going to take a long weekend, and I'm going to do my best to disconnect as best as I possibly can. And my colleagues will be amazing and will be incredibly respectful of that. And I know that they will, that they have my back. So that's certainly helpful. I'm in the process of planning a vacation for August to get away for a couple of weeks, and hopefully, if all goes according to plan, we're as a family we're going to go away. So that certainly helps. I try to do things on the weekends, where I may have to work for a few hours, but I am intentional about taking a break and going. I have a dog and we like to hike. So I take him for a hike for a couple hours. I get sort of a 7-kilometer walk in, and I feel like, okay, like I had a bit of a break. My oldest plays hockey, and so getting out to watch her play, that's definitely a part of it for sure. Like just getting a break and putting my phone in my pocket and not looking at it for that hour and a half. It sounds so insignificant, an hour and a half, that's nothing, but it makes a huge difference in my opinion. And so for me, that works. But what I've really learned through this whole pandemic is it's not a one size fits all. And if my colleagues were listening to this, they'd laugh at me because they hear me say that all the time. But I think wellness isn't a one size fits all. So for somebody, it's meditation. For somebody, it's a podcast. Or for somebody, it's a book. or a puzzle or a walk or an exercise class or getting to the gym. It's going out for a dinner with friends. It really is not a one size fits all. And so I think the best advice that I have for people is to learn to know yourself and learn to know where you get your positive energy from, and where you get that positive energy, try to do as many opportunities to gain that as you can when you're not in the office or you're not at the hospital. Because I think that makes a huge difference. So whether it's, spending time with your kids or your parents or other family or friends or hiking or whatever the case may be, it's figuring out what brings, it sounds kind of silly or cheesy maybe, but figuring out what brings you joy and figuring out how to slate that into your day, or your week or your weekend or whatever time you have off, figuring out how to push that into your day.
It's the whole tidying thing, right? About getting rid of things that don't bring you joy.
Yeah. And trust me, it's way easier to say than it is to do. And I would say I'm a work in progress. I am by no means perfect. I am definitely a work in progress. If I'm going to be really honest, I love my job and I love what I get to do. And so sometimes what brings me joy is just pushing, a COVID policy aside and getting into something that's new, or a way to do, a celebration for staff or an award, or getting into something that brings me joy, whether it's, doing this podcast as an example. I knew that this would be something that I would thoroughly enjoy doing. So, so saying yes to things that bring me joy, even when it's at work. It's, like I said, I love what I get to do. So and I don't just say that, I actually genuinely mean that. So being able to do things that bring me joy when I'm here, I try to do as well.
Yeah, well, it comes through for sure in terms of listening to you and your, your vulnerability. And I'm struck that, here I'm talking to a healthcare leader who also, effortlessly sort of moves into conversations about family and the other parts of your personal life. So would you say that, do you divide those two things? Are they two different parts of your life, or do they exist together all the time?
I think they have to exist all together all the time, because, the way social media is, I have teenagers, so they text me all day long. I use the funny story in wave one. My son got a lizard as a gift, mainly because it was pandemic guilt, I think. But I resisted getting him a lizard for 15 years. And then on his 15th birthday, I was like, oh, just give him a lizard. And he texted me one day in wave one. He's like, Mom, I've lost the lizard. And I was like, it's 10 o'clock and I'm in Toronto and I don't live in Toronto. So I'm a 45-minute drive. I'm not getting in my car at 10 o'clock in the morning to drive back home to find the lizard. So I think they have to exist together. Because the kids have that ability, particularly when they were online for school, because they were at home. So they, would think nothing of just texting me because they're at home. They think nothing of just texting me and being like, you have to find my lizard for me. The lizard was found. It was in the cage. Problem was solved easily, just with a little bit of mom creativity. I told him to look a little deeper, and he did. And Rusty the lizard was located safely. But I think, they have to exist. And I think, in the same way, my oldest turned 16 during wave one of the pandemic. So it was okay, well, we're not having a sweet 16 birthday because we are in full blown lockdown. That was 1,000% lockdown. Nothing was open but the grocery store. And so it was okay, so how do we figure this out? And so, logging off my phone and disconnecting for 12 hours, which was a huge deal in wave one, to give her some sort of sense of a pretend version of a normal birthday. So yeah, they have to exist together. And I'm pretty transparent about that. I'm an executive, I'm a healthcare worker, I'm a mom, I'm a wife, I'm a daughter. I'm a sister. So there's, all these roles I play. And when you're in healthcare, particularly during COVID, you get, even when you have no clinical background, and to be clear, I have zero clinical background, you get inundated with questions. Well, is this going to be over? And suddenly you're like this like infection prevention and control expert. So yeah, I think they have to live together at the same time. And some days you're a great parent, some days you're a great executive, and some days you're neither. And you know, it's a challenge for sure, but you figure it out, or at least I think I have. Yeah, I mean, I share with both my kids the challenges of working. I think it's important for both of them to see their parents both working and navigating life in that way. And I think I'm a better parent because I work. So I'm able to give both my kids a line of sight into what it's like to be a leader, to be a female leader, but also to be a mom and to figure out how that all works at the same time. So yeah, I think they work together.
Yeah, well, you're a role model, so and a living, breathing example of what they can be and the challenges, how you overcome those things. So I mean, speaking of challenges, so I mean, thinking back, it's like, what is it, 2019, before there was something in the world called COVID. What was the biggest challenge that you as a healthcare leader or an HR leader was facing? Like, what was the thing that you were trying to solve before all this happened?
Oh my goodness, I don't even know that I know the answer to that question. I was I was in a unique situation because I'd only been on the job for about a year when COVID hit. Well, about a year and a half. So I was still sort of, I would say, in a way, kind of finding my way as I had been an executive in another hospital, but a significantly smaller hospital. So I was still sort of finding my way into the structure of Sunnybrook and what the organization was and what it stood for, and navigating the complexities of having a very large portfolio. So I mean, I think probably the biggest challenges were certainly in the same way they are now, recruiting and bringing staff in and retention, but in such a different way, in such a simpler way in a lot of respects.
How so?
I think, well, we didn't have the HHR crisis in the same manner as we do today because we didn't have the burnout that we did. And so, recruiting was something that we always did, but not to the degree of, I would say, urgency, maybe is the best word, that we're doing today. And I think back then we were back then. I mean, it was 2 years ago. It sounds like I'm talking about it's like 40 years ago. But I think in a way we did recruiting in a more traditional way. So we recruited people and we didn't think about things in a creative way. So as an example, we have sponsorships, and so the way it works is if a nurse joins our organization and they would like to they'd like to be a nurse in critical care, they apply to, and if accepted, they go through a sponsorship program where they get extra education and then they get extra mentorship so that they're ready to be a critical care nurse. And the way we did it in 2019, we ran so many sponsorships a year. Now we're doing 2 and 3 times the number of sponsorships. So I would say, and we were very traditional. We would recruit them into these roles, and they would stay as a frontline nurse for a year, maybe 2, maybe even 3, before they would be eligible for a critical care sponsorship. And now we're looking at, well, how long do we need to have them be a nurse before they go into this sponsorship? And so just changing and pushing the way we think in I think, in some respects, the positive of COVID, if there is any, and I do think there are, to be honest, but I think one of the positives of COVID is forcing us to think differently. Like, hang on a second, let's think about this in a different way. That's the way we've always done it. Is that the right way to do it? And so I think from a recruitment perspective and a retention perspective, hearing from our staff and understanding from our staff what they actually want and what that looks like and how can we make that happen. And I think we were a little more apt to just sort of say, well, that's how we've always done it. And I think there is no that's how we've always done it with COVID, because there was never a we've always done it that way, because everything was new. And so we've changed the way we think. And so now it's like, okay, let's think about this differently. Well, what about it this way? So I think, I'm reading a book called The Opposable Mind right now, and it speaks to exactly that, like thinking about a challenge in not a black and white manner, but in a way in which we can look at the problem and think and come up with a middle ground that appeases both sides, but thinks about it in a different way. So just thinking more creatively, I think, is probably the answer to that.
So flash forwarding to today, I mean, what's the burning issue that you're dealing with? I mean, you've made some allusion to, that you're still dealing with a health human resource, shortage and challenge. But I mean, do you want to expand on that more, or describe the big burning issue that you're dealing with today?
Yeah, I think there's sort of probably two big issues that could be significantly broken down, and we could do a whole podcast on this one probably. But HHR, which is the gap in staffing in all levels and all areas, but in particular in our clinical roles, nurses, but also pharmacy and lab techs, and the roles that have really been leaned on over the pandemic. Pharmacy, obviously, from the vaccine; labs, obviously, because of testing; and then nurses, because nurses were caring for the patients. But there are a number of other gaps as well, and I don't want to take away from the roles that our OTs and our PTs and our social workers and numbers of other members of our clinical teams and non-clinical teams provide. But the gap, certainly from a nursing perspective, is quite significant. And couple that with the second sort of big issue, which is I would say burnout and retention. So those who may be eligible to retire because they're 55, but were planning on working till they were 60. That's a big factor. Leaving 5 years earlier than they were otherwise going to, or leaving the profession altogether because they're just, tired and looking to find a changing profession or work somewhere else. I think those are the two issues. So I worry about, I guess it's one big issue really, it's HHR, but I worry about the health and well-being of our people that are here. And I worry about how do we attract and retain attract people to this organization and then retain them, and what do we need to do, and it's funny, we talk about various ways to retain our staff, and I made a sort of offhanded comment that seems to have gotten traction, which is you can't build a retention plan on free coffee and chocolate, and you really can't. If I ever write a book, that's going to be a chapter in it. But you really can't.
The book.
Yeah, there you go. But you really can't build a retention plan on free coffee and chocolate. It just doesn't work. You've got to figure out what it is that is speaking to the staff, whether it's flexible schedules. So you hear in my title has workforce optimization, and that's really around understanding what the workforce needs, understanding their demands, both at home and at the office or at the hospital. What do they need? How do we work to give them what they need, but without compromising what we as an organization need, and how do we care for our patients? So giving greater flexibility to scheduling, being more accommodating in terms of what that schedule might look like. And, so we're doing that kind of work. We're looking at how we can give greater consistency to our staff, but also greater flexibility. And so I'd say, it's a big bucket. HHR is a big bucket. And it's a multi-pronged approach that you have to take. It's recruiting, it's retention, it's scheduling, it's looking at the data, it's understanding where people are going, why are they leaving, as simple as, the exit interviews that we need to do to understand, it's finding out that somebody might potentially retire and looking at a way to build a mentorship program where they can be, a late career nurse and provide mentorship to our early nurses. It's looking at all that creativity and all of the ways we can do HHR. That's very different than it was 3 years ago, because we're just having to think, pardon the term, but outside the box all the time. So I'd say that's the biggest burning platform, and there's multi-pronged components to HHR, but if I had to give you one word, it would be HHR.
Okay, thank you. So, in the context of all of that, the challenges that you're facing, the burning platforms you're trying to undertake, I mean, there's a lot of time and energy being put into these things. What's suffering as a result?
Oh, that's a great question. I don't know. I would say, truthfully, we're just doing everything. And so, I don't necessarily know that anything's suffering exactly, or nothing's dropped off. I mean, maybe what's suffering is our own wellness, and our ability. Like, I think about my HR team and their ability to, navigate working with our staff across the organization when we redeployed them and moving them from one area of the hospital to another when we did redeployment. And that was work that didn't happen pre-COVID, and so now it's happening. So what suffered as a result? Nothing. They just did other things. They did other stuff as well. I mean, we certainly took opportunities where we could to streamline processes to make things a little easier. But I don't necessarily know that I could pinpoint something specific that's suffering, other than I think maybe for me personally, maybe my lack of sleep. But I don't really know that there's anything that's suffering exactly. I'm not close enough to the frontline nurses on a daily basis to give the answer that they would maybe give. But from a leadership perspective, the only thing that I genuinely worry about is the health and well-being of our people. I mean, not the only thing, obviously. There's lots of things I worry about, but I would say that the thing that, when we talk about suffering, the thing that I worry about the most is the health and well-being of both our people and our leaders, and how do we make sure that they refill the energy pot so that they can be able to give what they need to give when they're here, but also equally as important when they're at home.
So how does it express it in yourself personally? It's like, if you're tired, you're not getting enough sleep, you're not getting, your vacation, you're having to track down lizards and, at odd hours of the day. How does that come back to you as Kristen, and reflect itself in terms of your work or your relationships?
I'm super conscientious about all of that. And I do have a tendency to just call things when I need to call them. So if I'm having a grumpy day, or I feel like I'm looking at something from the lens of an exhausted mind as opposed to a clear mind, I actually just own it. My husband might not say this, but I think I'm relatively self-aware. So I genuinely know when I'm having a day. And both my kids played hockey. My son doesn't play anymore, but I learned the most amazing thing in hockey, which is the 24-hour rule, which is take 24 hours. So if I'm really frustrated by something, this morning I got into my car and my daughter had left my gas tank literally on empty with the light flashing. And that's super frustrating at 6 o'clock in the morning when I'm just trying to get to work and it's minus 25 degrees out. So, but you know what? I texted my husband and had a good rant. But I waited I didn't wait the 24 hours because we do live in the same house, so I can't exactly wait 24 hours, but I did wait a good few hours before I texted her, and I was like, listen, and I did it in a really kind of casual way, but I didn't get mad. I just, she's 17, so she's relatively new at this whole driving thing. So I just said, listen, next time you're going to take the car for the day, please make sure that you at least put some gas in there so that I have enough to get to work, even if I don't have enough to get home. but yeah, I'm pretty self-aware. So I do try to acknowledge when I'm having a day. And like I said earlier on, and I really can't reiterate this enough, I have amazing colleagues that I get to work with every day and who I can be myself with. And so if I'm having a day and it's just not a great day, I can say that to them. And they're like, okay, how can we help? What can we do? Take a deep breath, send me a funny joke or a tweet or whatever the case may be. Like, I'm really, really fortunate. I'm surrounded by amazing people, my family, my friends, my colleagues, both in Sunnybrook, but also I have really, really amazing colleagues in the health system that I can rely on, and I think that that's been super helpful and super important for me and for my own wellness and my own mental wellness for sure.
Yeah, maybe we need a code Oscar or something that we can declare when we're having one of those days. But yeah, I think through a lot of what you've been talking about here today, and I've reflected on it as well during COVID, that one of the things that COVID has given us is the facility or the recognition for the need for connection and working together. That we can't do it alone, and not only that, we're interconnected because that's how the virus is spreading. So we really do have to work collaboratively. So I think it's great that you have a team that you trust with and have that connection with, where you can work together in this really, really positive, amazing way. So maybe just as we get set to close, then, Kristen, looking beyond the pandemic, what will we need to do to support leaders to get back to health?
I think the best thing we can do is to make sure that we give them the space to take the time that they need, and whatever that may look like, and give them a sense of, for lack of a better word, I think permission. I think one of the things that I've done over the course of the pandemic is sort of own it. So I've said to my staff, look, like, leave early, or take that day off, or make sure that you've got some time, at whatever, at this break or that break, or I have staff, direct reports, many of which have very young kids, and so saying to them, and we're lucky in that, like, my immediate team, for example, my immediate team of leaders, we work in a situation where they're not caring for patients, obviously, so they have a little bit more flexibility in their calendars and their schedules. And although they work incredibly hard, there's some flexibility to, on Wednesdays, to leave at 4 to get their, kid to Taekwondo class. And so I think, that for me has been a big factor in giving people a sense of permission to, incorporate, as we talked about earlier, incorporate their personal life with their work life and figure out where the balance is. And I think that is a tremendous level of stress when you've got, competing, whether it's you've got elder parents that have to be cared for, or, small children, or in my case, teenagers that leave gas tanks empty. You've got to give them that, you've got to give everybody an opportunity to be themselves. So I think that's a big factor. And then you alluded to it, like, vacation is huge. We need to figure out how we can, give people the space and the time to not just take time off, but to fully disconnect. And we're really lucky at Sunnybrook because we are so big. And so while we are big and we are complicated, and that comes with a series of challenges, it also comes with people that you can lean on to cover for you when you take some time off. And I think that's a huge factor. And so holding people accountable. So I did this last summer. I held each of my leaders accountable for telling me when they were going to take time off. And last summer we didn't have the COVID numbers. And so it was a little bit calmer, if you will, and a little bit more settled. And so I made sure that myself included, I made sure each of my members of my team was taking at least a week off. I myself took 2 full weeks off. We went traveling within Canada. I used it as an opportunity to teach my kids that Canada has more than just the province of Ontario. Mm-hmm. And so we went out to the West Coast, and we spent 2 full weeks out west, and I really disconnected. And I think, really just giving everybody, I think you role model that as a leader, but you also give people, when you role model it, you give people permission to not feel guilty about taking time off. And I think that's vitally important.
Yeah, we did the same. We went and saw the East Coast, but yeah, it's a place to reconnect in other ways. So it's really
For
key.
sure. For sure.
So thank you, Kristen. I really appreciate you taking the time with us here today. You've been so generous and so candid, and I certainly reflect on the adage that you can't really know a person until you've walked a mile in their shoes. And so I don't think that we can't help but learn and understand, I think, a little bit more about what it's like to be a health leader today, having spent here this time walking in your shoes and hearing from you. So thank you very much, and take care. Best of luck.
Thanks. It was a pleasure.
You've been listening to the HQ, and I'm Dale Sherback, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.